Welcome to Active Doctors Online March webinar. Unless you've been following the news or know someone who has personally been affected, many are not aware of the consequences of lead poisoning. But what you don't know can hurt you. Today, Active Doctors will explore the effects of lead poisoning and some of the hidden sources of lead. Joining us today is Clinical Assistant Professor from Georgetown University and Active Doctors Online's Medical Director, Dr. Howard Zahalsky. Dr. Zahalsky, welcome.
Thank you very much, Caitlin. I'm happy to be here. All right, so today, as Caitlin said, we're going to be talking about lead poisoning. So, the consequences of lead poisoning. What does lead do in your body that makes it so dangerous? To start with, the main way that lead hurts you if you have too much lead in your body is that it binds to certain enzymes and makes them ineffective. Well, what are enzymes? You've probably heard the word enzymes, but probably don't know exactly what it is that they do. The first thing that the enzymes do is that they help turn one chemical into another. Anytime anything is growing or being built or changing in any way in your body, it requires an enzyme. Enzymes are also known by other names depending on their functions, including hormones. Anything that you know of that is a hormone is also an enzyme. Some of the more common enzymes in your body include insulin, for instance, and thyroid hormones, which regulate your body's metabolism. When anything is built, you need enzymes. Now, here is our slide about how lead can affect the health of children. Kids obviously are growing more than adults because anytime anything changes, particularly when we're talking about growth in children, it needs an enzyme. So what part of the body will be affected by lead will depend on what parts of their body are growing. Well, the first and the most dire consequences of lead poisoning have to do with the growing brain. Children are not just growing structurally in their brain, but they're growing functionally. Their brains are getting bigger, but they're also learning. When you have lead poisoning, those nerve cells that are growing, getting bigger, making more connections to other nerve cells in the learning process are going to be inhibited by the presence of lead. In addition, there's a secret about nerve cells. The nerve cells themselves can't do everything they're designed to. People think very, very quickly. Sometimes you might describe that as thinking on your feet. Well, and remembering things from a long time ago. How is your body able to save, store, and recall all of that information so quickly? Well, in order for nerve cells to work as fast as they do, they need to be insulated. There's a coating on most nerve cells called myelin. The myelin coating allows signals to travel throughout the nerve cells and from cell to cell much more quickly. There are certain diseases, for instance, multiple sclerosis, where you have degeneration of this myelin coating over the nerve cells. ALS, Lou Gehrig's disease, is also a disorder in which you get degeneration of the myelin. Well, when you have an overdose of lead in your body, you are not able to create the myelin coatings on the cells as well, and because of that, it becomes much harder to learn. IQ goes down, and there can be dire neurological consequences. Here on this picture, you can see some of the consequences on the brain are lower IQ, attention deficit disorder, hearing loss, and damaged nerves. You can also have seizures, go into a coma, hyperirritability, and even death from severe lead poisoning's effect on the brain. But the brain is not the only place in children where lead affects them. Some other common areas where lead causes harmful effects include the blood. Blood is one of the parts of your body that grows and changes the most. Your red blood cells, your entire blood circulation in your body is destroyed and recreated every 90 days. And since any time you grow or create something new, it requires enzymes, lead poisoning can very much affect the growth of blood cells, leading to low blood, or the medical term for that is anemia, and we'll talk about that a little bit more in a little while. What other parts of children might be growing? Bones. Bones are definitely growing when you're a child, and lead not only inhibits the growth of bones, but actually can deposit in the bones, creating abnormalities on X-ray itself. There's obviously a variety of other ways on the slide that it shows that lead can be harmful. It can cause abdominal pain. It can cause kidney failure. It can cause problems with your blood vessels and lead to high blood pressure. These are all things that children are going to be much more susceptible to because their blood vessels, their kidneys, their intestines, their bones, their nerve cells are growing much more rapidly than in their adult counterparts. That's not to say that adults don't have to worry about lead at all. And on the next slide, we'll see how lead can affect even adults. So as you can see, many of the similar ways in which lead can harm children, it can harm adults, in particular the neurological system. Now, in adults, your brain is usually pretty fully formed. The brain isn't growing. It's not creating too many new connections. Sure, you're still learning some new things and creating some new memories, but the structure there, the nerve cells themselves, are usually already in place. So how does lead poisoning affect the nerves of adults? It tends to work more on the peripheral nervous system, the nerves that go out of your brain, down to your arms, down to your legs, to your other parts of your body. This can lead to coordination problems, to muscle weakness, to numbness and tingling in your hands and your feet, an increased likelihood of falls, and other signs of peripheral nervous system disease. As I said, even adults continue to destroy and recreate their entire blood circulation every 90 days. So you can see on the right side of the slide, one of the things listed again is anemia, low blood count because your body can't make blood cells properly. When you don't have enough blood circulating in your body, then your body can't carry oxygen properly, which again will lead to weakness, but can also lead to heart attacks, to strokes, to shortness of breath, and to a lot of other consequences from just not getting enough oxygen going around your body. What's some other parts of your body that continue to grow into adulthood? Well, your reproductive cells. Until a woman hits her mid-50s usually, and for men their whole life, they are constantly generating reproductive cells. And with lead poisoning, your body is less able to use the enzymes needed to make that happen, and it can lead to infertility, low sperm count, and other sexual dysfunction. Low testosterone, for instance, which is also another hormone or enzyme. You can see there are some other issues as well. You can get nausea and abdominal pain. You can get skin changes. You can get visual problems. In your mouth, because you have growing cells in the lining of your mouth, you can have taste disturbances or gum line issues. So none of these sound like good things, and they're obviously all things to be avoided, especially in children. So we have to be very vigilant as to the sources of lead in our lives and how they might affect us. So how might a person become lead poisoned? And on the next slide, we're going to see one of the ways that we've been hearing a lot about recently, people getting lead poisoning. Contaminated water. There's been a lot in the news about Flint, Michigan, and how their water has become contaminated by lead. Now, let me just give you a little bit of background on Flint if you're not completely up to date in the news. What happened was Flint changed its water supply. Now, even I had heard some things that when I read about it some more, I found to be not quite the whole truth. What happened is that Flint was getting its water supply from Detroit, but a new water company was starting up that offered Flint lower rates for their municipal water. However, the new company wasn't going to be ready until the end of this year, 2016, to supply water. However, when the Detroit Water Company found out that Flint was going to be leaving, they kind of got pissed off, and they cut Flint off from their water early. So Flint needed for about a year and a half, 2 years, to find an alternative water supply until the new water company was ready to supply them. So they went to the local river and decided that they were going to just siphon water and treat their own water for a year and a half until the new water supply company was ready. And that's where all the problems began. Now, the problem was not actually in the water of the river itself. That didn't have a lot of lead in it. In fact, most water supplies like rivers don't have a lot of lead in it. But it was a dirty river, and it had a lot of bacteria in it that needed to be cleaned. As a result, they had to put these special decontaminants into the water. Now, in Flint, like most cities, a lot of the houses, a lot of the apartment buildings are old. And old buildings and old houses generally were constructed with lead pipes bringing the water from the water mains to the houses. The water mains themselves are usually built with steel, but the pipes that actually go to the house are built with lead. Even that's not a problem. Now, on this picture, we're going to see this is what the lead pipes look like. You say, oh my God, that's disgusting. Look at all that crud building up on the inside of the pipes. Who wants to be drinking that? The answer is me. I want to be drinking that. Let's look particularly at the pipe on the right. You can see there's kind of a silverish circle around the pipe. That's the lead. But then there's this layer, and it's best seen at the top of the pipe, of crud that's building up on the inner side of the lead pipe. Those are mineral deposits that over years and years and years, chemicals, dirt, stuff in the water, minerals in the water, build up on the inside of the pipe. That's okay. That's actually fine. That actually protects the person drinking the water from those pipes from getting lead poisoning. When you put new lead pipes into a house, your chance of getting exposed to lead is much, much higher than when those pipes are old and they have the mineral deposits. So what was the problem here? The problem here was because they switched to the dirty river water, they put chemicals into the water to kill off the bacteria. Those chemicals dissolved the mineral deposits on the inside of the pipes. The reason that the water is disgusting looking was not because there was a lot of crud in the pipes. It was because the chemicals that they were putting in it to kill the bacteria was eating away at these mineral deposits on the inside of the pipes. Those minerals were now coming downstream, and it was exposing the silver underside of those pipes, the lead in the pipes, and dissolving that as well. If they had just used the water straight up, there would have been no lead poisoning problem. Of course, everyone would have gotten sick from all the disgusting bacteria in the river water, but there wouldn't have been a lead problem there. Another reason that old pipes frequently leach lead is grounding. When you build a house, you want to make sure if it gets hit by lightning, not everyone's going to get fried. I mean, after all, there are all these wires going through the walls of the house. Well, the way electricians usually ground a house, make sure that if it gets hit by lightning or if there's a short in the electrical system, it doesn't electrocute everyone in the house, is they ground the wires. By that, I mean they take some of the electrical wires and they wrap them around something metal that goes all the way into the ground so that if there's any electrical short, that electrical short will travel through the wires to whatever that metal connection to the ground is and send it to the ground. And traditionally, electricians always wrapped their electrical wires to ground them around the metal plumbing, like lead pipes. Well, it's also been shown that doing that causes an electrical current to run constantly, a very low-level electrical current to run constantly through the lead pipes and causes them to release a little bit of lead into the water because of this chronic level of electricity running through them. So when you ground pipes, if you have lead pipes, you're also running the risk of exposing more lead through your water supply. And that's what happened in Flint. Let's go on to the next slide. So if you don't live in Flint and you're not having trouble with your water supply, do you have anything to worry about lead in your water? And the answer is yes. Obviously, if you have an older house, it still may have been built with lead pipes, and if your electricity is being grounded through the lead pipes, there's still a chance that some lead is leaking into the water. Although hopefully, unless your water company is putting bacteria-killing chemicals through the pipes, you have enough mineral deposits that have built up on the inner side of the pipe that's protecting you from the lead deeper in the pipe. But maybe the people listening to this talk are saying, oh, I don't have to worry about this. I don't have any lead pipes. I have a newer house. My pipes were all built with copper pipes. which is the standard nowadays. Most new houses and new buildings are being built with copper water intake pipes. So there should be no problem with lead, right? Wrong. Here are some pictures of your typical copper piping that's being put together in houses. The copper pipes have to be attached to each other so that they don't leak. After all, the copper pipes have to make a lot of twists and turns, so they build them in with individual pieces of pipe. They still connect those pieces of pipe with lead soldering. Why? Because lead is a much more meltable metal than copper. So where they connect the copper pipes to each other, they tend to put lead, even in new buildings with new piping. But they think, well, there's so little lead because it's only right there at the connections that it shouldn't be too harmful. But we're finding out that lower and lower concentrations of lead in water is still dangerous. So even just the amount of lead that is put in the soldering has the potential to be harmful until those mineral deposits build up many years later. So getting a brand new house with copper piping sometimes can be more dangerous from a lead perspective than buying a house, again, that had copper piping that's 10 years old and has now had a chance for some of those mineral deposits to build up on the inside of the pipe. One of the styles over the last decade or so has also been brass fixtures in terms of your faucets, for your sink, and in your bathroom. To have brass was considered over the last couple decades to be very, very stylish. Well, in order to make the brass moldable into the shapes of those pretty faucets, they generally had to include up to 2% lead. And it's been found that over years, some of that lead that was used to construct those faucets in brass faucets can be leaking out. So the use of the more commonly used polished brass, excuse me, not polished, polished nickel, the now stainless look that's going around, may actually be better than the use of those brass fixtures. Now, traditionally, water, however, has not been the main source of lead in terms of lead poisoning. Where did people, up until recently, get most of their lead poisoning from? And we'll see that on the next slide. Lead paint. Lead paint has, for decades, been the most common source of lead poisoning. Lead paint production stopped in the United States in 1978, but a study found that 83% of homes made prior to 1980 have lead paint in them. There's a lot of ways that this paint can hurt you. Obviously, most people don't go around eating their paint, but on the next slide, we'll see the main way that people end up getting lead into their body through lead paint. It's a growing child, and look at her mouth. It's covered with dirt. She probably didn't just wipe her mouth. There is a condition that is not terribly uncommon among children called pica. Pica is a desire of a child, and sometimes even into adulthood, to eat dirt. Kids will eat soil, and kids, for whatever reason, really love, if they have pica, eating paint chips. And it is a not uncommon problem, especially in inner cities where there are more old buildings and there's more old paint, for kids to peel a little bit of paint off the wall and eat it. And it has long been a common source of lead poisoning. But make no mistake, even this child who may be living in a more rural setting and is just playing in some dirt, dirt itself can be a common source of lead poisoning. Well, how does the lead get into the dirt? For decades in this country, we used leaded gasoline. And that leaded gasoline, sometimes it spills, sometimes cars release it into the environment. It has gotten into the soil. There's much of the east coast of the country that is famous for having lots of battles and Revolutionary War and Civil War time. Well, all of those bullets that are now in the soil leaching their lead were made out of lead. And so there are certain areas, particularly famous areas where there were lots of battles, Williamsburg, Gettysburg, where there is a high level of lead in the soil. There's also areas near landfills where a lot of old lead-painted objects, everything from toys to cars to old construction material to old fuels, has leached into the surrounding soil, leading to high levels of lead. So there are many parts of the country where the lead levels in soil can be particularly high. And if you have a kid who likes to eat dirt, some kids have developed lead poisoning as a result of that because of their pica condition. So how do we diagnose lead poisoning? And on the next slide, we'll see the first way that we can diagnose lead poisoning. So here's what's called a peripheral smear, what your blood looks like under the microscope from someone with lead poisoning. And I'm going to point out a few different things because you look at this and say, oh my God, what am I looking at here? There are some pink cells, there are some purple cells. There are a couple of things that look like, we'll call spiculated cells, cells that instead of being circular look like they have points coming out from them. Those are cells that have been affected by lead. The edges of the cells become rough and pointy, and they don't carry oxygen right. Bring your attention, we just circled them on the screen. As you can see, inside the one on the left, there are a bunch of little darker purple dots. You can see that also on towards the top of the screen, at the edge of the screen on the top. You can see there are some cells with more. It looks like someone took an ink pen and just started making dots inside of the cells. You can see that in multiple cells throughout the slide. Those are actually little lead deposits that are building up inside the cells. Before we had a good test for lead, this is how we would diagnose lead poisoning, is we would look at a child's cells under the microscope and see if they had any of these pointy edge cells or if any of these cells with little blue dots inside of them. And that could be diagnostic for lead poisoning. But there are other ways to diagnose lead poisoning now. We can actually measure lead levels, which is a much more accurate way of determining whether there's been lead poisoning. According to the CDC guidelines, any lead level above 10 micrograms per deciliter, don't ask me how they got to that unit, but any level above 10 micrograms per deciliter is considered dangerous. In actuality, as we do more research, we find that lead at any level probably is unsafe and probably has negative effects. But between 10 and 14 micrograms per deciliter, we're just supposed to do education. We're supposed to teach the child or the person or the family about the dangers of lead and how to avoid it. You don't actually start treating someone with medical therapy until the lead levels get above 45 micrograms per deciliter, 4.5 times higher than the initial level on the test. However, recent information has found that a child's IQ can drop approximately 1 to 3 IQ points for every 10 micrograms per deciliter above 10. So by the time you have a child who's up to 45 micrograms per deciliter, you may have lost somewhere between 4 and 12 IQ points. And that may not sound like a lot. The average IQ is 100. But that can be a lot in terms of ability to learn. Maybe you had the next Einstein if it wasn't for them being exposed to Flint water. So we need to take lead poisoning very seriously because even very small levels, even under the threshold for CDC treatment guidelines, can have major impact on the future intelligence and neurologic development of children. So besides for avoiding water and making sure your kids don't eat dirt, are there any hidden sources of lead that we should know to avoid? And we'll go on to the next slide here. What are the hidden sources of lead? And we will now see on our next slide is folk remedies. There are a lot of folk remedies in North America and throughout the world that contain lead from when people didn't necessarily know better. This is a picture of Greta. I may apologize if I'm pronouncing it wrong. And there's another similar Hispanic remedy called Arzakon, which are lead-based chemicals that are found to treat upset stomach or indigestion. They may make your stomach feel better, but you could be poisoning the children you're giving it to with lead. As you can see on the slide, there are also Indian folk medicines such as gasard, which again was a tonic for indigestion, and a Chinese herbal remedy used for colic pain, again indigestion, called babasan, which was given to pacify young children. They may make your stomach feel better temporarily, but you may be risking the neurologic health of your children by using these remedies. They are not commonly used in the United States anymore, but there are a lot of immigrants to our country, and they could be using some of these brought over from their native country. Now let's go on to the cosmetics on the next slide. Lipsticks. Who would have thought that the lipstick you're putting on your lips could be poisoning you with lead? In 2010, the FDA did a study and found lead in 400 different brands of lipstick. 5 of the most common brands of lipstick with lead in them were all from the same manufacturer, L'Oreal. So be very, very careful when picking out your cosmetics to make sure that you aren't picking something that uses lead. Why would they use lead? Well, it gives them that nice gloss to them. It makes them malleable so they can give them that nice, pretty lipstick shape. But they can be very harmful for you. And again, more and more studies are showing that there is no safe lead level. So even if the amount of lead in them is fairly small, it is not something, especially when you're talking maybe tweens or teenagers using these lipsticks, that you want to expose your children to. So what do we do if you do have a problem with lead? You live in Flint and you just found out about the water, or your kid has been eating dirt and you take them to the pediatrician and you find that you have a higher lead level. Well, the treatment, medical speaking, if you get to that, is called chelation therapy. The most common medicine used for chelation is called EDTA. What it does is it binds lead in your body and then allows your body to get rid of it without it doing any more harm. There's a couple of problems, though, with chelation therapy. Number one, it does not reverse damage already done. So if you are already suffering from the neurological consequences of lead poisoning, some of these problems may be irreversible. And although some of them might be a little bit reversible, it can take weeks, months, or years, even after you've given chelation therapy, for the neurological consequences of lead toxicity to be reversed. But a lot of the learning deficits in children, because the cells already were supposed to have grown and you don't get to redo your childhood, a lot of those can be permanent. Now, there's another risk of using these in children. When you've been exposed to lead chronically over a long period of time, because you've had pica for a long time and you've been eating a lot of paint, or you've been living in Flint, Michigan, and now you've had 2 years of drinking lead-filled water before you realize the problem, the lead will build up in tissues outside of your blood. It has to be in the blood to spread to the brain, to spread to the kidneys. But sometimes it deposits into the bones. Now, that's not good for the bones. It can get in their way of growing. But once it gets fused to the bones, which happens with lead, it stops being dangerous. When you give EDTA, it clears the blood of the lead that's floating around in the blood, but it also pulls some of that lead that's been fused to the bones out of the bones into the blood to be taken out of your body. But not all of it binds with the EDTA so quickly. So when you have a child who has been poisoned with lead, you say, whoa, why don't we give them EDTA immediately? Well, because if the blood levels of lead are low, giving the EDTA will actually cause the lead levels to spike upwards in the short term as it pulls the lead out of the bones. Sometimes if you're not having acute lead poisoning issues, if it's only chronic issues, it is better to just avoid giving them any more lead, make sure they get clean water, make sure they're not living in a house with lead paint, rather than giving chelation, because the chelation can actually cause a surge temporarily in lead levels and actually in the short term make the problems worse. when you could just remove the lead from their environment, and over the next 90 days, their lead levels will slowly go back down to normal on their own. So, in summary, avoid lead wherever you can find it. Make sure you have healthy drinking water. Make sure you hopefully don't have lead pipes. If you do have lead pipes, or if you have even lead soldering, it is not a bad idea to get your water supply checked to see if there's lead, especially if it's a newer house. Make sure your child sees the pediatrician and bring any neurological symptoms to your pediatrician's attention immediately so that your child can be tested for lead, and there are potential treatments available if the situation is bad enough and calls for it. So on the next slide, we'll see how Activ can help you. Well, with Activ Doctors Online's revolutionary patient health record, we can help you make sure that you minimize your risks of lead poisoning or other poisonings. We can track your child's lead level. With our family plans, you can enroll your entire family in Activ Doctors Online's PHR, and you can keep track of your lead levels from your pediatrician so that even if you move or change doctors, you'll always have all of your old lead levels, so your doctor will be in a better position to appreciate if maybe your child's lead levels have gone up from one year to the next, or if there's been a growth problem from one year to the next that should trigger alarms that maybe will prompt the doctor to do a lead level. In addition, should you have a problem, should you notice that your child's lead levels are up, through our second medical opinions, we can put you in touch with some of the top experts in lead poisoning or whatever problem your child may have throughout the country and throughout the world. And finally, with our e-consultation system, if your doctor is enrolled with Activ Doctors Online, you can have a virtual discussion with your doctor, a telemedicine conference with your doctor to discuss any concerns you have, whether it be about lead or about any other issue. Now with that, I'm going to pass it back over to Caitlin, who can tell you a little bit more about Activ Doctors Online's products.
Thank you, Dr. Zahalsky. Here at Activ Doctors, our vision is to reinvent healthcare by providing user-friendly mobile health solutions that allow people all over the world to live healthier, safer, and more productive lives. We strive to educate, engage, and empower our members to really take control of their health destiny, to save time, money, and in some cases, lives. We invite you to try Activ Doctors Online free for 30 days. Simply head over to our website, www.activdoctorsonline.com, and click Get Started on the homepage. If you would like more information about the webinar, would like to schedule a demonstration of our unique health platform, or have any questions about the service, please feel free to contact Dr. Zahalsky or myself directly using contact@activdoctors.com. You can also reach us on social media. Find us on Twitter @ActivDoctors and on Facebook and LinkedIn @Activ Doctors Online. Thank you, and we hope you join us next month for another informative health webinar.